everyone. My name is Adil Zainal, a student nurse from Davao Doctors College. And today I'm going to perform female urinary catheterization return demonstration. So urinary catheterization is the insertion of a flexible tube or catheter through the urethra into the bladder to empty the urine. Catheterization also reduces the risk of infection and kidney damage. So prior to the conduct of the procedure, I have already checked the doctor's order for catheterization. This is to ensure that I have a right patient and a right procedure to be done. And also, I have already performed the hand washing to deter the spread of microorganisms and to prevent the spread of infection and contamination. And also, next I have prepare the necessary equipment needed in this assessment because preparing the equipment can save time and energy. Alright, so I have here a two-way Foley catheter, a drainage bag, medical disposal, waste disposal, a lubricant, and a catheterization set. Hello, ma'am. My name is Adil Zainal, your student nurse for today. May I see your wristband, ma'am? Please state your complete name. Alright, and your birthday, please. Okay, thank you. So, ma'am, I understand that you have a problem in urinating, so that your doctor, Dr. Ong, ordered a urinary catheterization. So, what I'm going to do, I will insert a tube to your urethra going to your bladder to excrete your urine. Later on, during our assessment, you will feel a little bit itchy and uncomfy. But after our assessment, you will feel relief. Would that be alright? Okay, thank you. So, ma'am, is it okay with you if I close the door so that no one from outside will disturb us while doing the assessment? Okay. Alright. So, ma'am, do you have any question and clarification before we proceed to our assessment? Okay. Now, position the patient in a dorsal recumbent position with the knees flexed. This is done to provide good visualization of the meatus that will be introducing the catheter, and also the gravity will aid the flow of the urine when the bladder is higher to the end of the catheter. Now, I'm going to secure the urine bag under the bed frame of the patient. Alright. Now, drape the patient, exposing only the area to be used. This is done to avoid the patient from getting embarrassed. Okay, ma'am, I'm going to expose your genital area. Alright. Alright. And now, I'm going to put this pad underneath you to prevent the bed linens from getting soiled. Alright. Now, apply direct light for better visualization of genital area. We're going to open the tray and arrange the equipment for the convenience and accordingly to avoid contamination of the sterile items. Right? I have here a lubricant, a sterile forceps, sterile water, sterile gloves, and a two-way Foley catheter, and I have a 10cc syringe, and also a plaster. Now I'm going to use my sterile forceps to cleanse the genital area with the cotton balls soaked in cleansing solution. Alright, the first line first. Always remember not to rephrase the stroke because it may contaminate the area that cleanse. Now I'm going to clean the labia majora. Okay. Now the labia minora. And lastly, to one side of labia minora. Alright. Now, I will be using the 70% alcohol to clean my hand. And use sterile gloves to prevent the contamination. And now that I'm done wearing sterile gloves, now put the eye sheet to the genital area. Now pick up the catheter at least 3 inches from the tip of the thumb and place the thumb and one finger of the left or right hand between the labia minora and separate and pull up gently. Now insert the catheter into the meatus for 2 to 3 inches or until the urine begins to flow. Okay, ma'am, I'll be exerting the catheter. Just relax, ma'am, ha? Alright, will be a little bit itchy. Okay, right. And now, if the specimen is need to be collected, pinch the catheter with the thumb and the finger while placing the specimen in a container position. This. Rest the hand of the pubis area while holding the catheter in a place to prevent the pulling and pushing of the catheter. This is done to avoid the infection of the urethra. Now connect the catheter to the urine using the urine bag. Now secure the connection of the urine bag to prevent and to avoid the leakage of the urine. Now inflate the balloon using 10 cc of sterile water using a 10 cc syringe. Now inflate the balloon with the sterile water. Now secure the indwelling catheter by taping it to the patient thigh and allow some slack of the tubing to accommodate the patient's movement. And now, place the patient in a comfortable position. Alright, ma'am. I'll be browsing your genital area. Alright. Alright, we're done. Now, remove the gloves. Alright. We are done with our assessment. So, how would you feel? Do you feel better? Alright, so do you feel comfortable right now? Okay. So, ma'am, if you need something, just call me. I will assist you. Do the aftercare of the equipment that used, and always remember to perform hand washing after doing the assessment. For the documentation of the urinary catheterization, document the size and the type of the catheter used. In this assessment, I use a two-way Foley catheter in latex silicone coated, size 14, and also record the amount of fluid that inflate in the catheter. I use 10 cc sterile water, and also don't forget to record the urine reaction and response, and also include the other significant reaction.